My name is Dr. Lackey, and I am with Midwest Center for Joint Replacement in Indianapolis and Bloomington, Indiana. And at MCJR, we are passionate about taking the pain out of joint replacement for everybody involved, and that is both patients and family members, caretakers, and anyone we come in contact with. And so that was a fantastic introduction about what is arthritis. And I'll get to talk a little bit first about specifically arthritis of the hip, how we manage it, how we diagnose it, and what we do about it. So first, when should you see a specialist such as myself, who's a hip and knee fellowship trained surgeon? You should see one of us anytime you're having a problem with your hip that's interfering with your life. I want to start with an anecdote. A good friend of mine I ran into on the street a couple weeks ago, and he introduced me to his father-in-law who was in town. And his father-in-law found out what I did and told me that he'd been putting off his hip replacement for years and just been miserable, but just didn't want to face the facts and talk about a hip replacement. And I asked him where he hurt, and he actually hurt right on the side of his hip. And it turns out he had bursitis or tendonitis of the hip and could have been living pain-free without surgery 5 years ago when it started hurting. So we'd love to see any of you in our area or any OrthoAlliance surgeon in Indiana and Ohio. We'd love to see you and to help you to get back to the things you love. So specifically hip arthritis, again, arthritis means joint inflammation, but why is the joint inflamed? It is usually because the joint is worn out. That's osteoarthritis, where the cartilage wears off the bone, and that's is a product of wear and tear, but all humans wear and tear on their joints. But some people are just unfortunately wear out their joints, and that has to do with the genetics of their cartilage. And sometimes in the hip, also the shape of the hip joint and just how we developed. And so I don't know if you can see both hips on the screen, but at least the one hip that's peeking out from my side views of the presenters shows a huge cyst up in the top of the ball and socket joint. And that is definitely a worn out hip, or what we would call bone on bone. And when you're bone on bone or worn out in the joint, most of the time we don't need an MRI. The exam is very simple. We watch you walk and we rotate your hip in and out. And so even if you come in for knee pain, we will very subtly rotate your hip just to make sure we don't miss that, because the hip arthritis can hurt down the front of the thigh and into the knee, which is quite common. So patients never fit into clean categories, but if they did, we would say, hey, if it hurts in your groin or your front pocket, it's probably most likely your hip or down the front of your thigh towards the knee, and sometimes shoots all the way through from front to back of the groin. And that's usually the joint. If it hurts right on the side, that's most often lateral trochanteric pain, or often called bursitis or tendonitis. And then lastly, if it hurts in your low back or back pocket or buttock or down the back of your leg or shooting down your leg, that's most often from your back or pinched nerves in your back. And so we trade a lot of patients back and forth, trying to get them to the right place when they come in thinking they need to sign up for a hip replacement and they really need a back doctor. So most of the time we can see the arthritis on the x-ray like this one, and we don't need to get advanced imaging such as an MRI. Just to mention, of younger patients with hip pain in the groin and in the joint is more often some kind of tear, or can be hip dysplasia, different factors there. And that's often treated differently if the hip is painful but not worn out. So what treatments are available for hip arthritis? We'll talk about this with all joints. And you'll hear, and you probably have heard as patients with arthritis, you've heard about cortisone shots. We really don't do those a whole lot in a worn out hip. And two reasons. One, it's been shown that if you have a hip replacement within 90 days of a cortisone injection in that same joint, that you have a much higher chance of getting an infection after surgery in that joint. And when people have had cortisone shots in a worn out hip, they often say, yes, it did feel much, much better, but it only lasted for about 3 to 5 days. And we would say, that's really not worth it. What's the 30-year plan about feeling better? We'd like you to feel better a lot more than 5 days. And so, and that all then blocks them out from having a hip replacement. It's very common that when a patient comes in with a worn out knee, ready to talk about a knee replacement, they've been putting up with it for over decades, over 20 years often. And a lot of times it's less than 1 year for a hip. Hips tend to wear out faster, and the treatments don't work as well. And it's much poorly tolerated when the hip gets stiff and stops rotating. It's hard to get in and out of the car. It's hard to do most activities, and so patients don't tolerate it as long. Weight loss can help a ton. I had a patient who decided she would lose weight to try to make her hip replacement safer. And when she lost a significant amount of weight, her hip no longer hurt. And she didn't come back to see me for some time. But then life happened and she gained the weight back, and then her hip hurt again, and her body was prohibitive for surgery at that time, though we can do a fair amount of heavier patients. But the key with arthritis for me is that motion is lotion. And we tell patients that the number one thing that you can't, I've got a 7-year-old coming here to help me. He's going to say hi. James, there are hundreds of patients here watching, so we're going to have you go back down with mommy. Sorry about that. So we say motion is lotion. There's nothing better for a joint than motion. And so low impact motion is super helpful. Physical therapy in the hip or knee or anything is great for strengthening the muscles around, but the hip will not start moving with therapy, so it's never curative in hip arthritis. Surgical treatment of the hip is a total hip replacement. The parts, hopefully you can see the slide, all of the slide to the right. At the bottom is an example of a common hip implant. Patients always want to know what the implants are made out of. That is the metal socket and metal stem in the bone is titanium. And the pink ball, yes, it's pink for both men and women. The pink ball is ceramic, and that ceramic ball is made by one company that supplies all the other companies in the country. And then the liner, the white plastic liner, is polyethylene, or a special type of plastic. And we hear every day in the clinic, I was told that hip replacements and knee replacements are good for about 10 years, so I need to just be miserable and put it off as long as I can. And that could not be farther from the truth. We find that patients, the sooner if they are a good candidate and the joint's worn out and they failed conservative measures, not delaying is very good. Patients get back to life sooner at a higher quality of life and end up living longer as well. Patients that come in and are in a wheelchair because they've been putting it off or didn't know about hip replacement for 5 years have a much harder time regaining the strength and mobility that they've lost. The top right picture is a hip replacement on X-ray, and that's what we would check in the office after surgery at follow-up. The top middle picture shows where an average incision is for an anterior approach to the hip. And that approach has allowed us to use X-ray in surgery, line up the hip perfectly and get the parts in the exact right position, and a little less dissection on the patient, a little quicker recovery, though all of our hip replacement and knee replacement patients, almost all 90% are home in their house the same day as surgery. So what can you expect after surgery? We tell patients there's lots of phases of recovery. The first few days, you're laying low, you're doing some very gentle exercises, you're using ice and taking some pain medicine. Most of our patients are back to a normal day-to-day activity level at 6 weeks. The tissues are not fully done healing for 6 months. Meaning there's lingering tiny bits of pain, but a lot of our patients are walking pretty normally in the first 2 to 4 weeks. But once you're healed up with a hip replacement, we almost never have any restrictions on any of our patients. And we say, you name it, you can do it. If you want to run a marathon, ride a mountain bike, jump on a trampoline, we'll let you do whatever you were doing before your hip wore out, because we want to get you back to doing the things you love.